Hi, I'm Mike Bechtel, and I'm so excited today to talk to you about Capital Health Share administered by Redirect Health. And this is a new way of looking at providing your company and your employees with healthcare and health insurance. Now, this is a result of over 20 years of innovative work that we've put in. We started a healthcare clinic about 20 years ago in Phoenix, Arizona, and we ran into the same problem that most business owners run into. The cost of insurance was just going up year over year, and it became unmanageable, really on two sides. The one side was the monthly premiums. You've probably dealt with this where every year you're getting a double-digit rate increase, and it just stops making sense. One, for you as the business owner, but also for the employees. And the second part is, what's the cost of actually using that insurance? When your employees have to go and use it, we found that the deductibles were getting so high and the copays, it didn't make sense anymore. But because we were doctors, we knew how to fix this. You can think of our founders, Dr. Janice Johnston, when she had to interact with her children or her family members, the idea of really having a mom with a medical degree. She never asked her kids when their effective date was or what network they were in. She was able to just help them. And when they needed additional care, she made sure that they got into the visits that they needed to get into. They got exactly what they needed. There was never too much or too little. It was always the right amount because it was a mom. So we knew how to eliminate a lot of the unnecessary activity that happens in the healthcare industry, and also the waste and the administration that doesn't need to be needed. You can imagine this dropped significantly the cost of our health insurance as we started to put this into our company, and our own team started to use it. Now, word got out. We're in all 50 states now, and business owners just like you can come in and save a lot of money, but also provide your employees with the great benefits they need to make sure they get the right care. Now, our plan is more than just the benefits. It's also the performance that we put into it. And that's what lets us keep the pricing so low. So the great thing about the plan is the price is fixed. There's no underwriting for it. We've made it really simple and easy. You can see the pricing here, $333 for an employee, $650 for employee child or employee spouse, and the $945 for the employee and family. Those are monthly prices. Now you can offer an affordable solution to your team. And there's 5 main things we do to keep the price down. The first is when your team enrolls, we're going to capture some information. We call this our population health. We call it hit the ground running. This is where we're going to ask some things about what prescriptions they're taking. Do they have any doctors that they see? Do they have any procedures or anything scheduled? And are there any chronic conditions, things like diabetes or asthma, so that we can swarm them even before the plan starts? The next thing we do is we make ourselves available 24/7. Now, some people call this telemedicine. We call it virtual primary care. There's more to just taking a phone call. I mentioned the mom with a medical degree. A mom is always going to make sure everything's taken care of, that we're getting the right care at the right place and always at the right price. So virtual primary care, you can text in, you can call in, and you can even use our Easy app to connect with a doctor. If you do need to go in person, we've created a national direct primary care solution for all the routine care. And that means things like primary care office visits, pediatric office visits, urgent cares, chiropractors, blood work, x-rays. We've removed the copays for those things. So we've made it easy to get the right care and made it really affordable for your team. Now, if you do have some extra care, things where you maybe need to go see a specialist, you end up in the hospital, you're having surgeries, we have our team do care navigation. This is a really important piece. It's our doctors working with your doctors to make sure your care is organized in an easy and simple way. This gets rid of a lot of the unnecessary waste and administration that happens in healthcare. And so that helps us also eliminate the unnecessary spending. And the last thing we do then is we organize all the financial arrangements. We're going to coordinate all the care, we'll navigate all the care, and we'll make sure all the financial arrangements are set up for you. Okay, so I'm excited now to talk to you about the actual benefits of the plan. And I'm going to start with the everyday care. This is the routine care part. Now, this plan meets the minimal essential coverage part of the Affordable Care Act. And what we've done here is we've started with whenever anybody needs care, we've made it really easy. Just contact us first. You can text us, you can call us, and you can even use the Easy app. Here's the benefits of the plan, though. Those 24/7 visits, unlimited, there's no cost to those. You can call in anytime, text in anytime. There's no cost to it. What we've seen is about 60% of the time, we're going to be able to help you right over the phone and get all the care that you need, create a care plan for you, even write prescriptions when it's appropriate. The next thing is when you need to go in person, visits like primary care, office visits, maybe even going to an urgent care. There's no copays for those visits. Since the plan is compliant with the Affordable Care Act, anything mandated by the Affordable Care Act to be free is also free in this plan. That includes your yearly physicals. For women, they can be done at your OBGYN. Things like colonoscopies and mammograms, age-dependent, women's birth control, although those things are at no cost there. We've also included chiropractic office visits, and this is important. If you haven't ever seen a chiropractor, there's no copays for these. You get 12 per member per plan year at no cost for you. It's an easy way to make sure your neck, your back, take care of those things. And then also x-rays. So x-rays have no cost to those things. The plan also has a tiered copay program. What that means is everybody's going to get a card. You can either get it on the app or you can get a hard copy. When you get a prescription, you can go to all the same pharmacies you'd use today. You're going to show them your card either on the app or your hard copy, and they'll run that through. There's a $10 copay tier, a $25 copay tier, and it goes up to 5 different tiers. And let me give you a quick example of how this might work. I've got 5 kids, so my kids use this all the time, but I've never had to engage with healthcare. It's always been my mom or my wife. And one morning, on a Saturday morning, my daughter woke up and I walked into her room and I knew she had pink eye. She's crying. She says, "Dad, my eye hurts." And I said, "Yeah, you probably have pink eye." Now, my wife's a nurse. We know what to do, but think about in the current healthcare system, how you have to interact with that today. You got to load the kids up in the car. You have to drive to a pediatric office or an urgent care, all to get that script that you probably already know what you need. So I told my wife and I said, "Hey, hon, I got this one." I snapped a picture of my daughter's eye on the app. I sent it in, a few text messages back and forth, and they confirmed, "Hey, we're going to send a prescription over for the pink eye." I walked over to the pharmacy by my house. I picked it up and I'm home in 30 minutes and I have it. That's the ease of using the Everyday Care Plan, is getting the healthcare you want and you need, but at the right price. And so it made it really easy. Now that we've talked about the routine care, you're probably wondering what happens when something major happens, and we have a way to protect you from that hospitalization and catastrophic. And Capital Health Shares partnered with Zion Health, which is a medical cost share company. So you're wondering, what's a medical cost share? When you think about insurance, you pay a monthly premium. And before the insurance company pays, you have to pay your copays or your deductible and reach your max out of pocket. And then that's when the insurance company pays. And a medical cost share works very similar. You pay a monthly membership fee, which would be similar to a premium. Instead of a deductible, they have what's called an initial unshareable amount, or an IUA. This is the amount you pay before the medical cost share community is going to pay anything. And again, it's an IUA, an initial unshareable amount. So with the Capital Health Share plan, there's a $1,000 IUA up to 3 times a year, whether you're an individual or a family. That means for any medical need you have, you would pay the first $1,000 of care, and then the medical cost share community would pay the rest, up to 3 incidents a year. If you have a 4th medical need happen during the year, then that is fully shareable from $0. Okay. The IUAs are in a 12-month plan year. So as long as you have no more than 3 in that 12 months, you would pay the first $1,000. An example would be you need to go to like a specialist and you end up getting knee surgery. That would be one medical need. You'd pay the first $1,000 of care. If something else happened, that would be a new $1,000 of care. Because it is a medical cost share, there are some rules around how pre-existing conditions are shared. Now, pre-existing condition, what's going to happen is when you sign up, they're going to do a 24-month look back. Any symptoms or treatment you've had in the last 24 months would be considered a pre-existing condition. And there would be some guidelines around how those needs would be shared. Now, any other needs that are not related to those pre-existing conditions would be fully shareable, and there's no limit or cap to the sharing amount on those. For the pre-existing conditions, again, the back 24 months, any symptoms or treatment, the first year, if you have something related to that pre-existing condition, after you pay your $1,000 IUA, the community would share up to $25,000. The second year after you pay your $1,000 IUA, the community would share up to $25,000 again. Year 3, after you pay your $1,000 IUA, the community shares up to $50,000. And then in year 4 and on, the community shares, after you pay your IUA, the $1,000, the community would share up to $125,000. So this is a new way to look at healthcare to protect you from that catastrophic and high dollar cost. And I'll tell you how it works here in just a second. Now that we've talked about the plan and the benefits that are associated with it, let's talk about how it works. And this is what I mentioned earlier. The performance is actually part of the plan. Now, there's 4 easy steps to this. The first one is really important. It's about contacting us first. Now, a lot of people think, why do I have to call you first? It's not a call for permission. It's not a call for authorization. This is a call to get care. I had mentioned Dr. Johnston, who really was a mom with a medical degree. That team's grown. We are available 24/7 to help you get the medical care that you need. Remember, a lot of the times we're going to be able to help you right over the phone. But if you do need to go in person, that second step is picking a provider. Now, the great part of the Capital Health Share plan is that it is an open network. And that means you can continue to see all the same doctors that you see today. And if you don't have a doctor, don't worry, we'll help you pick one. Step 3 is the most important part of this plan. It's how we eliminate a lot of the wasteful spending and the unnecessary activity that happens in the system today. This is the care navigation. It's our doctors at Capital Health Share talking to your doctors and making sure that we organize the care in a simple and easy way. Once we get all of that care organized, it's easy to get the right price for the care. And that's what we do is the financial advocacy. We make sure that you never overspend for the care that you get. And make sure you always are going to pay the right price for it. And then we're going to make sure those bills and those claims are paid timely. We have a third-party administrator that works directly with us to make sure those bills are paid on time. Now, let me give you a few examples of exactly how this would work. And I have one with my son. So my son, when he was 15 years old, he was doing backflips on our trampoline. And he could do them really good. He thought he could do one on the grass. He texted me. I wasn't out there. I wish I would have seen it. And he said, "Hey, Dad, I tried to do a backflip. I kind of went for it. I think I broke my shoulder." Right? My wife's been a nurse for 20 years. We probably knew his collarbone was broken, and it's a Saturday at 4 o'clock. Now, most people would just rush to the emergency room to get it taken care of. And I said, "Hey, hold on, hon. Let's just call the 24/7 number and let's see what the doctors on the line say." So I called up. It got escalated right up to a medical provider. They organized a visit to me at an imaging center that was about 5 miles from my house. I went down. They had ordered an x-ray for my son. The x-ray was $0 copay. We drove home, and about 45 minutes later, we got a call back from the provider that said, "Hey, your son's broken his collarbone and there's nothing you can do with it. It's just going to heal, but go and get him a sling." So I drove over to one of the big corner store pharmacies. I picked up a sling for $12, and at 5:15, I had all the health care that I needed. I didn't have to use any insurance. My son's in a sling, and then they followed up with me every few days for the next 6 weeks until we got another x-ray, which cost $0, and his collarbone was healed. That's how easy and simple healthcare can be and should be. Now, let me go to a more elevated one, because you're probably going, I get that example, but what happens if something major happens? And so we had a member call in on a Sunday. They had some stomach pain, and our provider recommended that they be seen in the morning. We called to follow up with them that morning to make sure they were coming to the visit. And the member's spouse said, he's on the bed, he's curled up, he can't do anything. And we said, get to the emergency room right away. He goes into the emergency room. We called ahead and we made sure that they knew why he was coming in. And when he was there, obviously his appendix had burst. So a burst appendix, they do an emergency appendectomy. 6 weeks later, they get a bill for $86,000. Okay. Now on this plan, because of the initial unshareable amount, because they had the Capital Health Share part for the catastrophic and hospitalization, the member was going to have the $1,000 bill. The work that we did with the financial advocacy was we got that bill from $86,000 down to $13,000, just over $13,000. That's how we can keep this price so low and consistent. That's the importance of making sure, call that number first so that those doctors there can organize your care, help you coordinate it and navigate it, and make sure all those pieces connect to make it as easy as it can be and to help you never overpay for any health care you're getting.